is looking at sort of after birth, but not really after birth, I guess during the fetal development, what can happen to it, and then the actual birth, and then lactation. So these two things right here are looking at that could affect the fetus while it's developing in the mother. This is talking about labor, and then this is lactation, which I'm guessing you guys know what that is. I guess I should present this. All right, so it says the first period of development starts during the 9th week and lasts until birth. The fetus looks obviously human, and the main difference between the embryonic and fetal periods relates to the organs. In the embryo, most of the organs are taking shape, and in the fetus, the organs are present and continue to develop. So once you become a fetus in that 9th week, your organs are all there, and they're just really, really small, but they're developing. So the rest of that time is really growth. The fetal period is a time of growth and refinement of the existing structures. The first trimester, which is week 1 to 12, during the last month of the first trimester, growth in the length of the body accelerates, but growth of the head slows. So if you look at a baby, sort of an ultrasound, you notice that a baby's head sort of looks like bigger than its body. Well, the body's going to start to catch up to the head, I guess, near the end of the first trimester. The cartilage-based skeleton begins to harden with the development of bone. So before this time, you're just made of cartilage. So if you don't know what cartilage is, think of feel your ear, that bendable but hard tissue, I guess, inside of your ear is cartilage. So it's able to move and bend. And that wouldn't be very good to keep us sort of, standing tall and strong. We'd sort of flop over. So we need that bone to keep us strong. And that's what the baby's going to start to develop during the end of the first trimester. At the end of the 12th week, the external reproductive organs are distinguishable as male or female. So at the end of these 12 weeks, so 12 weeks is like 3 months, that is when you are able to figure out whether you're having a boy or a girl. In the second trimester, which is week 13 to 24, this is by the 4th month, it says the heartbeat of the fetus is strong enough to hear with a stethoscope. So if you put a stethoscope to a mother's stomach, you should be able to hear the heartbeat at this time. The bones of the skeleton begin to form, the brain grows rapidly, and the nervous system starts to function. So this is when the baby is going to start being able to actually feel, because this nervous system wasn't developed before this 4-month period. As the fetal legs grow and develop, the mother begins to feel movement. During the 5th month, the fetus becomes covered with fine, soft hair and an oily substance to protect the still developing skin. This hair is called lanugo, which is usually shed before birth. So this is sort of like, I don't know if you've seen some people maybe even sort of like a evolutionary thing, I guess, that your body will create this hair to protect yourself. So some people that, I've seen this in people that are anorexic, they are not eating enough, they are always cold, their body will actually create this type of hair that is on you when you're a fetus, because it's sort of your body's last ditch effort in protecting your body and protecting yourself from the elements when you don't have, I guess, the fat or, protection of yourself. In the 6th month, the skin appears wrinkled because there is very little fat beneath it. The skin becomes more pink as blood-filled capillaries extend into it. If the fetus is born at this stage, it is unlikely to survive without medical intervention. So your babies can be born at around 6 months. That's 3 months early, but there needs to be a lot of medical intervention to be able to keep the baby alive. And you've probably seen this on medical shows or maybe I'm just the crazy one who watches them, but those really premature, tiny babies that fit into the palm of your hand, they need a lot of help to survive. So, ventilators and feeding tubes and all that stuff to protect them and to help them continue to develop outside of the mother. In the third trimester, and this is the final trimester between week 25 and 38, fetal brain cells form rapidly and connecting to form more and more intricate networks. So the brain is moving rapidly, it's trying to connect the neurons, and it's working to create those neuron networks. The testes of males will descend into the scrotum. So before that, the testes are inside of the body, but they'll actually move down towards the scrotum at this time. A layer of fat develops beneath the skin, so start to develop fat. The digestive and respiratory system are usually the last to mature, which is why infants that are born prematurely often have difficulty digesting milk and breathing. So, without having those, I guess, a baby has a hard time if they're born before the third trimester because they do not have the ways to breathe. That's why they need a machine and being able to digest, so they have to have certain things that are fed to them. Proper nutrition is important during all of pregnancy for both the mother and the fetus. So it's really important that the mother is eating properly so that the baby is also getting the right nutrients and not getting things that are not good for them, which we'll talk about in a little bit. Nutrition is especially important during the third trimester. Poor nutrition damages the placenta, which can lead to low birth weight, short stature, delayed sexual development, and learning disabilities. About 266 days after the formation of a single fertilized cell, a multi-trillion-celled being is ready to be born. So I guess it just goes right from that, but that's really quite amazing that within that time frame you can go from one cell to many trillion of cells, and now you can be born. In the addition to the nutrients and other beneficial substances that a mother transfers to the embryo and fetus, she can transfer harmful substances as well. So this is looking at teratogens, which is one of our vocabulary words for this section. This word up here. And this is basically a word that means stuff that is harmful to the baby, that's transferred to them, I guess, from the mother during fetal development. So whatever the mother ingests or inhales can end up in her circulating blood. Some of these substances pass through the placental system to the fetus's blood. This is especially significant during the first 9 weeks when developing organs are highly sensitive to environmental factors. So this is really scary because during the first 9 weeks, mothers might not even know that they're pregnant. So all of the things that they're taking into their body, ingesting, maybe they're going on a drinking binge, maybe they're doing drugs, or even taking certain medications that can be harmful to the fetus, is really not good because this is the time when they're very highly sensitive to all of these things. So it's hard to keep your baby safe if you don't even know your baby exists. So it's really important that we're always keeping track of that and bringing the best things into our body as we can. Many substances and conditions can affect the normal development of the embryo and fetus. The term teratogen refers to any agent that causes a structural abnormality due to exposure during pregnancy. So any sort of thing that can affect the baby during pregnancy is going to be called a teratogen. Cigarette smoke can constrict the fetus's blood vessels, preventing the fetus from getting enough oxygen. This causes babies to become underweight, and there's also an increased risk of premature birth, stillbirth, and miscarriages, behavioral problems, and reduced intellectual ability in children of smoking mothers. So just smoking cigarettes can have a huge effect on your baby. One of the most damaging teratogens is also the most avoidable, which is alcohol. It can affect the fetus's brain, central nervous system, and physical development. Babies who are affected by alcohol consumption during pregnancy are likely to have decreased weight, height, and head size, as well as malformations of the face and head. These children show varying degrees of learning and memory difficulties and often show unusual aggression or personality disorders. Since each mother metabolizes alcohol slightly different, physicians advise that all women avoid alcohol when pregnant, when trying to become pregnant, and when breastfeeding. The term that is used to describe all the disorders related to alcohol consumption during pregnancy is called fetal alcohol spectrum disorder, or FASD. So, someone can be diagnosed with FASD if their mother admits to drinking while they were pregnant. So, many people, or psychologists, are normally the people who diagnose FASD due to seeing these memory difficulties, aggression, personality disorders, all of these things showing up in a child. But the only way that a person can be diagnosed with FASD is if their parent admits to and signs paperwork to say that they were drinking while they were pregnant. If their parent doesn't admit to it and doesn't sign the paperwork, then the kid cannot be diagnosed with FASD. So they basically are diagnosed with other things like a personality disorder and a behavioral disorder and a learning disability, but all of those things added together are normally linking to the fact that they have FASD. Many prescription and over-the-counter medications also have teratogenic properties. Whoa, big word. So that's what I was saying before, even medications that you take. I know that I take blood pressure medication, and if I wanted to be pregnant, I'm not allowed to take that because it could hurt the baby. So if I was to get pregnant, continue to take my blood pressure medication, it could have bad effects on the developing fetus. Some antibiotics, some acne medications, anti-thyroid drugs, and some anti-cancer drugs are all ones that can cause harm to the baby. The most notorious prescription drug with teratogenic effects is thalidomide, and this was first prescribed to women in the 1950s to reduce morning sickness. Its use for pregnant women was discontinued when doctors discovered that an alarming number of babies were being born with missing and deformed limbs. Certain nutrients ingested in large amounts, particularly vitamins, can have teratogenic effects as well. I'm going to go out of this for a second. So thalidomide, that was given to babies given to mothers in the 50s to help them with their morning sickness. But babies were being born like this. So they were having deformed limbs, possibly no full arms, no full legs. These kids were not being able to walk. If we look at this lady, this is an older lady, obviously, but she was born in the 50s. So having those limbs, and just because they were being exposed to this drug that their mother was taking. So not good things can happen. Even certain vitamins can be bad for you as well. So if you are pregnant, you really got to consult with a doctor to make sure that everything that you're taking is okay. Vitamin C, the fetus becomes accustomed to large doses, and when the supply drops after birth, the baby develops symptoms of vitamin C deficiency, which is called scurvy, bruising easily, and being prone to infection. So you might think, oh, it's great, I'm taking lots of vitamin C, and then the baby, once it's born, doesn't have the amount that it once had, and it can sort of have a withdrawal effect. Other teratogenic agents include radiation, so like X-rays, You don't want to be exposed to those. You might notice when you go to like the dentist or something, they'll ask you if you're pregnant, just so that they can figure out if you are pregnant or not, because they don't want to put x-rays, because that can have a bad effect on your baby. Pollutants, so like PCBs, so those are things like plastics, which are not good. Sorry, I had to let a cat in. And organic mercury. So mercury is definitely not good, and you can get that from seafood. So eating certain fish is not recommended during pregnancy as well. Good judgment and decision making play key roles during pregnancy. Sometimes the mother cannot control her exposure to teratogens. So yeah, many people can't control their effects of teratogens. Think of like a lady living in China, for instance, by a huge factory. She can't move, that's where she lives. Sure, she's being exposed to pollutants that could affect her baby. Here's some other examples. People in many northern Aboriginal communities rely heavily on fish and wildlife in their traditional diet. The presence of environmental contaminants in the food chain due to industrial discharges and runoff from contaminated land is a great concern for those who rely solely or partially on traditional foods. Women with these contaminants in their body are reported to have a higher number of miscarriages, lower birth weight, babies who have difficulty fighting infection and disease, and children who are developmentally delayed compared with women who have limited or no exposure to these contaminants. So these women that are just living their traditional life are having effects on their babies just because of the contaminants that the, I guess, industrialized world has put on the environment, which is really sad. Now we're going to move on to delivery. So delivery or labor is known as parturition. So it says the birthing process is called parturition, and all of the events associated with parturition are commonly referred to as labor. These events typically begin with uterine contractions. At first, these are light, lasting about 20 to 30 seconds, and occurring every 15 to 20 minutes. Near the end of pregnancy, the contractions become stronger and more frequent. The onset of labor is marked by uterine contractions that occur every 15 to 20 minutes and last for 40 seconds or longer. So sometimes people will think that they're in labor, they'll go to the doctor and they'll send them home because their contractions are not close enough together. So they need to be between 15 and 20 minutes and at least 40 seconds or longer to be considered you're in labor. The onset of labor includes both hormonal and neural components. A positive feedback mechanism can explain the onset and continuation of labor. Uterine contractions are induced by a stretching of the cervix, which also brings out the release of oxytocin from the posterior pituitary gland. So in order for the cervix to start to stretch, a hormone from the posterior pituitary called oxytocin is released. If we look, I can't even spell. Just want to look back to a picture of this. So the pituitary gland, remember where it is in the brain. So that part of the brain is going to release oxytocin, which is going to go all the way to the cervix. Oxytocin will stimulate the uterine muscles both directly and through the action of the prostaglandins. Uterine contractions push the fetus downward and the cervix stretches even more. This cycle keeps repeating itself until birth occurs. Birthing may happen in numerous ways: horizontal position, squatting, or partially upright position. So gravity can help with birthing, or in water to lessen the shock of the baby's entry into the atmospheric environment. For several reasons, it may be not safe or possible to deliver a baby in the usual way. The baby may be in the rump first position, so basically they call that a breech birth, where their butt comes before their head. Um, it's difficult for the cervix to expand enough to accommodate this type of birth, which is called breech. Since the baby or mother could be harmed, the baby is usually delivered by cesarean section. So if they notice that the baby's not going to be coming out head first and they're going to come out feet first, that's going to hurt the mother and the baby, mostly because the head is sort of like the biggest part, so it helps to create the opening for the baby to come out. But also, there's problems with breathing. Breech births can be dangerous because the umbilical cord could get wrapped around the neck as it's coming out. And it's also, very damaging to the mother. So C-sections or cesarean sections are something that is often chosen during this time. Once the baby is breathing normally, the umbilical cord is clamped, cut, and tied. The baby is now cut off from the source of protection and nutrients it has depended on for the last 9 months. It must breathe, ingest food, and eliminate waste on its own. The cord eventually shrivels, and the place where the cord was attached to the fetus becomes the navel, or belly button, as we normally say. So as far as lactation and suckling reflex, it says hormones control the onset of lactation, the secretion of the formation of breast milk in the mother. Prolactin, so remember that's one of the hormones that is needed, is the hormone that is needed for milk production, is not secreted during pregnancy. High levels of estrogen and progesterone suppress its production in the anterior pituitary. Once the mother has given birth, the anterior pituitary begins to produce and secrete prolactin. Milk production starts within a few days. Before then, the breasts secrete colostrum, which is a thin yellowish fluid that is similar to milk but contains more protein and less fat. So not fully milk at the very first, just a really strong protein that the baby can take in and is really good for them. It also contains antibodies from the mother, providing the baby with protection from various infectious agents. When a baby suckles, it stimulates nerve endings in the nipple and the areola, which is the circular darker skin around the nipple. The nerve impulses travel to the hypothalamus and stimulate the posterior pituitary to release oxytocin. Remember, oxytocin was the thing that was released when you went into labor. Well, it also is released to create contractions of your mammary glands. And mammary glands, or lobules, are basically the glands inside of the breast that are going to create the milk. They contain alveoli, which are sacs with cells that produce milk. So alveoli is just like the sacs inside of your lung that hold air. The alveoli inside of the mammary glands are going to produce milk. So think of it as little pockets of milk. The lobules end in mammary ducts at the nipple. Contractions within the lobules cause milk to flow to the ducts, where the infant can draw it out by suckling. If suckling does not occur, or if it stops, milk production stops within a few days. So if you're not continuously breastfeeding, you will lose your milk. They say it'll dry up. So that's why it's really important that mothers will often use breast pumps. So it is pumping out the breast milk so that the baby has that if they're away from them or whatever it may be, so that they continue to have their milk production. Increased suckling stimulates increased milk production, which can continue for several years. So several years you can breastfeed. I was actually reading an article. I don't know why I was reading an article about this, but last night about how people in society sort of frown upon people who breastfeed their toddlers. So breastfeeding up to like 2, 3 years old. But they're saying like that it's really good for your baby. So if you can do that, you should. Um, but yeah, people in public definitely frown upon it when there's a kid running around and then all of a sudden they're breastfeeding. It can be a little weird, but definitely it's really good for them. So the longer you can breastfeed, the better. But also, many people have lots of trouble breastfeeding. I know my friend just had a baby and she was devastated that she couldn't breastfeed. But there's great formula out there that you can feed your baby that gives them the nutrients that they need to develop properly. So no shaming in not being able to breastfeed. All right, so that's 15.2. That's the end of that. So you can work on doing the um, assignment booklet. I took out the definitions and we don't have sketch notes and diagrams. I taken all of that out. But there should be some questions that go along with 15.2 that you can do from there. The next topic is on sort of the ways that we can, the reproductive technologies, I guess, but also the ways of not getting pregnant or not having children, which is tubal litigation and vasectomies. So we'll talk about that in the next video. Have a great one.